Seriously, thank you for coming out. This place is packed. I was not expecting this. But I do just want to start. I'm going to tell my story going through a gender transition and then detransitioning. And then I'm just going to get to the end of that. And then I'm going to let you guys kind of take the floor, ask me whatever questions you want. So if anything comes up while I'm speaking, just make a mental note. I'm going to try to get to as many questions as possible. That being said, I'm Katie Anderson, and I'm a detransitioner. And what this means is that I went through what's called a gender transition. I tried to turn myself into a man. So I went to doctors, they prescribed me hormones, I had surgeries, all to try to turn myself into a man. And then I later came to regret the decision. And I took steps to go back to living as my biological sex as a woman. So what started this whole thing was just a lot of confusion, a lot of shame about femininity. When I was growing up, when I was a teenager, I was going through high school, and I was just really uncomfortable with the way that my body was developing. So I was going through puberty, growing into womanhood, and I was just embarrassed of all those changes. And I also felt that I wasn't interested enough in dating boys. So I just didn't fit in with a lot of the girls around me. And because I wasn't interested in the boys like a lot of the other girls were, some of the upperclassmen at my high school, they had a test to determine if you're actually a lesbian. So it was the easiest test I've ever taken. They just ask two questions. They ask you, or it was just one question. They ask you, can you see yourself having sex with any of the boys in the room? And my answer was no. Now, sometimes if somebody thinks they might be bisexual, they'll ask if you can see yourself with a man, with a woman, whatever. But for me, it was just, can you picture yourself with one of the boys? My answer was a solid no, never. And so they said, that means you're a lesbian. And I kind of took that identity and I said, this makes sense. I'm a tomboy, I'm really uncomfortable with being feminine. So I must be a lesbian, and I must be more of a butch lesbian. So I wore men's clothing, and I still had long hair, but I was very, masculine. And then after high school, when I started in college, I was watching YouTube videos about other teenage girls. I was about 18 at this time. Other teenage girls who felt the same way I did. They were tomboys, maybe they were identifying as lesbians, but they still felt this overwhelming discomfort with their biological sex, growing into being a woman, and they started identifying themselves as transgender. So I'm watching all these YouTube videos. I was about 18 years old, watching all these YouTube videos of other teenage girls in the same position I was in, identifying as transgender now, taking testosterone, and looking happier than I could ever imagine myself. So I saw all these girls, and I thought, maybe I'm transgender. And so I put on that identity. The first thing I did was I went through a social transition. I asked everyone in my life, my parents, grandparents, cousins, everybody, to call me by a boy's name and use male pronouns to refer to me. Once they started doing that, it felt like I escaped womanhood, and I felt very confident in my new identity. So it just solidified me, being called a male, being called he, him, using a boy's name. It just solidified me in that identity because now I've escaped womanhood, something that I was so afraid of before. So I decided to go further with the transition. After social transition, the next step was medical transition. And all I had to do, it was my last appointment with my pediatrician. I was 18, and I went to her. I was going to start going to another one. I told her, I'm transgender. I need a referral for a gender clinic. That way I can start taking testosterone. And she was able to give me the referral, no problem. Then I got set up with a new doctor instead of a pediatrician, and got set up at the gender clinic. When I went to the gender clinic, the first time I went, I really thought that they weren't going to be able to start me on testosterone as quickly as they did, because I knew that there was a requirement that you had to have had gender dysphoria, the diagnosis, for at least 6 months. Which means I would have had to have a therapist for at least 6 months before I could get the diagnosis and get any treatment. But the gender clinic had sort of a workaround for that requirement, where they could set me up with their in-office clinician. I'm not really sure what her title is, but we'll call her an in-office clinician. And she asked me a bunch of questions when I was a kid, exactly like boy toys or girl toys. Did I like boys' clothing or girls' clothing? How do I feel most comfortable? What are my interests, my hobbies? It was very stereotypical stuff. But I said, I've always been more into the boy stuff than any of the girl stuff. And she asked me, have you had these symptoms for at least 6 months? And I had, so I said yes, and that was enough to get me started on testosterone. I didn't need any appointments after that. They were able to start me on testosterone, show me how to do a self-injection, and the testosterone came in the form of weekly self-injection. So they showed me how to do that every single week. I would inject myself with more testosterone, and the immediate effects were the deepening of my voice. I started growing a little bit of facial hair, especially on my upper lip here, and I felt this was an effect of testosterone. I just felt so confident, so energetic. And I was reading that as, I must be doing something right. If this treatment is making me feel so good, it must be right for me to do this. But really, it's just that testosterone makes you feel that. It makes you feel confident. It makes you feel energetic. Anyway, about a year into testosterone treatments, I had felt that I was ready to start having surgeries. So I went to the gender clinic and told them I'm ready for top surgery. And top surgery is a double mastectomy. A lot of breast cancer patients will have it. They'll have their breasts removed. They also do that as a gender-affirming procedure. So I went to the gender clinic, told them I was ready for surgery, and they did the same thing as before, where I just sat down with that person, and she made sure that I was good to go. Have I had these symptoms long enough? Have I been on testosterone for a year? We're good to go, check some boxes. And later that year, I had a double mastectomy. I had my healthy breasts removed, and I was 20. So I wasn't even old enough to drink yet by the time I had my first surgery. After that, things were going pretty well. After that surgery, I felt like I could stand up straight. I looked more masculine. I looked like I had a more masculine chest. And so my confidence was higher than it had been before. All the videos of those teenage girls identifying as transgender, now I looked as happy as they did in their videos. Because I was feeling the effects of the gender transition, and I was chasing that euphoric feeling, that high of seeing the results of all of this. And so my happiness was through the roof. And if anybody would have asked me in that moment, are you happy with your transition? Was it the right choice for you? I would say yes. But a few years later, about 3 years after the surgery, I started having some abdominal pain. And I just kind of ignored it for a little while, but eventually, about a year later, it started getting so bad that I couldn't even stand up straight. Some days I would wake up and I just couldn't stand up straight all the way because of the effects of testosterone on my reproductive organs. It's called uterine atrophy. So basically the muscles around my uterus, something like that, they get so weak that they pull, and so you really can't stand up straight. And so I went to the gender clinic and I told them what was going on. I told them I was in so much pain. I was very active and I wanted to go for a run and I couldn't run. I wanted to play sports with my friends and I couldn't. There was no more pickup basketball games for me. So I went to the gender clinic, I told them what was going on, and they said, this is exactly what happens with testosterone. We just recommend our transgender male patients, which means women taking testosterone, we recommend them to have a hysterectomy. So this was about 5 years into my transition. They recommended a hysterectomy, which is usually when that comes around. And along with the hysterectomy, the surgeons were able to they took my uterus, cervix, fallopian tubes, and both of my ovaries. Not all of that was medically necessary. Technically, I think the hysterectomy was because of everything that was going on with my uterus. They took my cervix and ovaries to diminish a risk of cancer. Fallopian tubes, I have no idea. But, yeah, they just took them. And I guess it just makes it easier if I'm going to go through future procedures to not have to worry about it, or if I'm going to be taking testosterone, they won't have to worry about checking for cancer. So they just took everything. And during the surgery, actually, something went horribly wrong. And I came out of the surgery, I was in the recovery room, and I was just getting worse and worse and worse. I was not getting better. The surgery was in the morning, and it was by that evening that I started losing consciousness. I was in so much pain. I was actually getting sick. I was actually throwing up. And I was telling the doctors, you need to give me medicine for this pain. It's too much to handle. And I'd never asked for pain medicine before. And they told me they already put the pain medicine in the IV. There was nothing else for them to do. So I was just getting sick, and I'm not exactly sure if it was the pain or if it was what was going on inside of me, but I started losing consciousness later that evening, close to the nighttime, and the doctors ordered an ultrasound. They needed to figure out what was going on with me. And they realized that one of my arteries was left open. So that whole time, that entire day, I'd been bleeding internally, and nobody knew about it. And it took them until the night to figure it out when I started losing consciousness. And I think at that point, when you start losing consciousness, your organs can start shutting down. They can start failing. So I was close to death. The doctors rushed me back in for emergency surgery. And thankfully, they fixed their mistake, and I have no complications of it to this day. I had 3 blood transfusions. All of my organs are working as expected, and nothing else came of that. But it really did scare me, especially because my family, my parents, they knew what was going on when all of that was going down. When I was unconscious, I was kind of drifting in and out of consciousness, but the doctors really thought that they were going to have to call my mom and have her come to the hospital to sign off on the emergency surgery, because they didn't know if I would wake up in order to do it. So they called her, they told her what was going on, they kind of had her on standby. But then I woke up long enough just to sign I don't even remember signing the paper, but I woke up long enough to sign it, and they rushed me back in, and now everything's fine. Now, the hysterectomy, it seems like that's what should have been a turning point in the transition, that I should start rethinking this, and I should go back. But it actually wasn't. After the hysterectomy, I felt really good. I thought, well, I don't have a uterus anymore, I don't have ovaries anymore, I don't have to worry about this stuff. My period's never going to come back. I just felt really good about that. Until about 6 months later, I got just a normal haircut. It's my favorite story to tell. I just went to my barber. I just went in for my routine haircut appointment. I've been getting the same haircut for years. I don't like changing things up. So it was the same haircut, talented barber. Everything was fine. I left. I gave her a good tip. I was so happy. Went back home to clean the itchy hairs off the back of my neck. It was a men's haircut, so I had all the hairs on me. And I looked in the mirror, and in that moment, I could only see myself as a woman. This is after 6, almost 7 years on testosterone, after a couple of surgeries. Nobody from the outside meeting me for the first time would have thought that I was a woman. Yet I was looking at myself in the mirror, and I can only see myself in that moment. The way that I looked, thank you, the way that I looked before I transitioned. And so that was really powerful. It really stuck with me. I didn't immediately start detransitioning then, but it did sow a seed for me to start rethinking things. And I started thinking, maybe this isn't right. But what's going to happen when I get to the end and there's no more surgeries to be had? There's no more effects of testosterone. Everything's plateaued. Like, what's going to happen then? Am I going to hit a wall and I'm not going to be able to chase that high that I want so badly? So when I started thinking about that, everything started crumbling. And I started thinking, I'm separating myself from God with every testosterone injection that I'm putting into myself. So I told myself I'm just going to stop taking the testosterone. And I did. And I went back to the gender clinic, and I told them I'm not taking testosterone, but I don't have ovaries, I need estrogen. And it was kind of all mixed up going to them, because they wanted to treat me as a male to female transgender patient, maybe to avoid the detransition statistic, I'm not sure. But I don't want to speculate. I don't want to tell them that they were doing something terrible if they actually weren't. But that's what it felt like. So I stopped going to them. I stopped taking the estrogen from them. And I stopped taking the testosterone from them. So for about, I think it was 4 to 6 months, I had just no hormones in my body. And I knew that I was putting myself at an extremely high risk for osteoporosis. And I was only 26 at the time. So I'm thinking, I'm really putting my physical health in danger. But I know that if I take this testosterone, I'm doing something against God. And so it was just hard for me to battle. Do I do what's best for my relationship with God? Do I not sin against Him? Or do I preserve my physical health? And I really didn't know what to do. But eventually I found a doctor, and she was able to give me estrogen, and then I don't have to make that choice anymore. And with the whole detransition came a couple of decisions. I could just stay quiet, and I don't have to go out and speak out about anything. And I think that would have been perfectly fine, because I came out of transgenderism, abused, humiliated, and mutilated, yeah. And so it's really hard to get up there and stand up and talk about all this and admit that I was wrong, and then also lay out my entire medical history for people. So for a while I didn't, and then the first time I did, I actually used a pseudonym, because I was a little bit nervous if, protesters were gonna come for me or whatever. But ultimately, I'm 28 now, some people ask. I'm 28, and I decided I am gonna speak out, I am gonna share my story, because it's not just 19 and 20-year-olds that this is happening to, it's children too. And that's especially devastating. At least I had a taste of what womanhood was like. At least when I decided to detransition, I had an idea of what that would look like. But if we're transitioning kids at 6, 12, even 15 years old, they don't know that. And if we had, we do have, but if we had 16 and 17-year-olds having to stand up here and go through this entire history and talk about all of this, that would just be devastating for them. And to be so young and have to do that, I don't want them in that position. So ultimately I decided, I am going to go out, I'm going to share my story. I'm strong, I'm an adult, I can do it. That way, the younger people don't have to. When they come out of transgenderism, they won't feel like they owe the world anything, and they can just heal on their own. And I think that's really important. So that's the reason I tell my story. And what keeps me going is that sometimes I'll do these events, and I'll come here and I'll give a talk, and even if it's just one person who comes up to me, asks me to pray for a sibling of theirs, they'll tell me that I've changed their mind, I've changed their heart, I've really touched them in some way. They understand a loved one's struggle even deeper, instead of just shouting, at their sibling, at their sister, at their brother. They actually can understand them and can ask them real questions. That's what keeps me going. So that's why I tell my story. And so I thank you everybody for coming. I would like to now open it up. So if anybody has questions, ask me anything you want. There's nothing too personal.